Hello everyone, how's it going? The World Health Organization says that colorectal cancer is actually the third most common cancer type worldwide. Well, what is colorectal cancer? Is there anything we can do to reduce our risk? And are there any new ideas on treatment plans? Well, if that sounds interesting to you, then keep watching. Now, colorectal cancer is actually a disease in which the cells in the colon or the rectum actually grow out of control. Sometimes abnormal growths, you probably heard of polyps, they can actually form in the colon or the rectum. And since these growths have a chance of turning into cancer, we want them found and removed. Now, typically this affects older adults, but this is something that can affect anyone at any age. Oftentimes it doesn't have any symptoms, which is why it's highly recommended for people to be screened for this type of cancer. Even though the rate of people being diagnosed with colorectal cancer has actually dropped overall, probably due to people getting screened and making lifestyle changes, those who are younger than age 50, that rate is actually increasing. So now the recommendation is to start the screening process at age 45 for most people. If you're at a high risk, your doctor may actually recommend that you get screened even sooner than that. Now, those who would be at higher risk would be those who are age 50 or older, Black people who are living in the United States, those with inflammatory bowel diseases such as Crohn's disease. If you have an inherited syndrome such as Lynch syndrome, you may be more at risk. If you have a personal history of colorectal cancer or polyps, or you have a family history, so you would have a blood relative who's had issues with colorectal cancer or polyps, you could definitely be more at risk. If you've had radiation therapy for cancer that was directed at the abdomen, you could be more at risk. Those who are diabetic or insulin resistant have a more of a chance of getting colorectal cancer. If you're obese or you have a sedentary lifestyle, if you're a smoker or you overuse alcohol, you could be more at risk for colorectal cancer. Now, as was mentioned before, there may be no symptoms at all, but you may experience some of these symptoms. A change in bowel habits, so you may have more frequent constipation or diarrhea. You may have rectal bleeding or blood in the stool. You may have ongoing discomfort in the belly. You may even have a feeling that the bowel doesn't empty all the way. You may experience weakness or tiredness, and even losing weight without trying. Now, these symptoms could actually be caused by other things, so you definitely want to be evaluated by your healthcare team to make sure you know for sure what you're dealing with. Now, before we move on to how we may be able to reduce our risk and if there's any new ideas of treatment, I'd like to remind you to like and subscribe if you're enjoying today's information. Also, always check out the links in the description box below. There you can find more information. Now, in order to reduce our risk, the best thing we can do is make sure that we get screened for colorectal cancer. Now, there are several screening options. Your doctor can tell you what will be the best place to start. Sometimes they'll just start with a simple stool test, which actually you can order one online. I'll leave a link below in the description box below. It's actually FDA cleared for over-the-counter use, and it is the same test used by labs and physicians for colon cancer screening. Now, there are other screening tests that can be done other than a colonoscopy, but if these test results come out positive or abnormal, you'll actually need to get a colonoscopy in order to complete the screening process. And this is because a colonoscopy actually allows the doctor to see inside the rectum and to see the entire colon. During the test, they can remove most polyps and some cancers. Some studies suggest that a diet low in animal fats and high in fruits and vegetables and whole grains may actually help reduce a person's risk. Of course, maintaining a healthy weight is always very helpful. Trying to remain active on most days, engaging in some form of exercise that your doctor says is safe for you. If we limit alcohol and avoid tobacco, this could also reduce our risk for colorectal cancer. Now, it usually takes 10 years for cancer to form in a colon polyp, but if it's left untreated, it actually can spread to other areas of the body. So at stage 0, that means you have abnormal cells that are only in the inner lining of the colon or the rectum. At stage 1, the cancer has penetrated the lining of the colon or the rectum, and it may have grown into the muscle layer, but it hasn't spread to the lymph nodes or other body parts. Now at stage 2, it means it's spread to the walls of the colon or the rectum, or maybe even through the walls to nearby tissues, but not in the lymph nodes. Stage 3, it has moved to the lymph nodes, but not to other parts of the body. Stage 4, the cancer has spread to distant organs such as the liver or the lungs. So we can really have a lot of peace of mind if we do go ahead and get screened. If there are any issues, it can be found early, which is when the treatment actually works best. Now, if cancer does develop, there are various treatments that can be used that include surgery, radiation, therapy, medication such as chemotherapy, targeted therapy, and immunotherapy. What I found was interesting is they're actually trying to study an option now in some colorectal cancers. There's a tumor that has a genetic mutation. It's called a mismatch repair deficiency, and immunotherapy works well for these cancers. So for the patients in the clinical trial, they're trying to start with immunotherapy. Now, once the treatment has been completed, they'll do some tests to find out if the tumor has shrunk. If they can find that the tumor is gone, then they will just closely monitor the patient for 4 months. Of course, if the tumor hasn't shrunk or they haven't been able to reduce it or eliminate it, the patient would have to use traditional treatments. But for those who it's successful for, and if this trial proves to be successful, it may actually help at least some patients to try to spare them from having to undergo radiation therapy, surgery, and perhaps even a permanent colostomy bag. So it's encouraging to hear that there are new treatments that are being studied. However, it's so much easier if we just get screened for colorectal cancer, so that hopefully we'll be able to avoid having to even think about any type of treatment for cancer. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.